Thank you for joining us here on France 24. You were just watching scenes from an apartment building here in the French capital. People out at their windows in a show of support and solidarity for France's medical personnel as they tackle the spread of the coronavirus. Those scenes taking place across France tonight. For more, we can go across to France 24's Catherine Norris-Strand, standing by in the neighborhood of Belleville for us. Catherine, people are in lockdown now for it's been, 4 days. This has come, to become a way to socialize with your neighbors who you probably wouldn't otherwise meet.
Exactly, it has become an evening ritual, and I have to say, Delano, it's sounding louder tonight than it has in the past few days. There are more and more people joining in, and there are people who brought musical instruments. I can hear them behind me now, people banging drums, pots and pans, sounding horns. So this is becoming more and more of an event as it goes on. It's the regular nightly rendezvous at 8 p.m. French time. Everyone comes to their window or their balcony and makes as much noise as they can, cheering, clapping, applauding, in a way of saying thank you to the medical personnel who are at the front line of France's battle against coronavirus. And it's also a way, as you referred to there, Delano, of showing solidarity between people who are largely confined to their homes. Well, they're supposed to be confined to their homes pretty much all the time. So it's a way of giving someone a wave, giving someone a smile, feeling that you're part of something bigger and getting some kind of emotional release, because it is proving stressful for quite a lot of people I've spoken to, being confined to a small space, not being able to go outside, people taking care of small children. Of course, schools and creches are closed here in France. So there's a lot of stress building up, and this is one positive way of letting it out.
Now, Catherine, we have 12,600 people who are infected in France. That's according to France's health agency director, Jerome Salomon. And the death toll now stands at 450. Could we possibly see that lockdown, which we have currently in place, being extended?
This is very much a possibility, Delano, because, as you've just said, France's public health director has announced the latest figures. So as they stand, France has 12,612 confirmed cases of coronavirus, and 450 people have died from the virus here in France, an increase of 78 in the past 24 hours. And while he was announcing those figures, Jérôme Salomon, the director of public health, repeatedly again called on members of the public to stay inside, to respect the rules of this lockdown and not to flout them by going out on the streets, and really trying to hammer home that point, because when you go out and about in Paris, a lot of the city is in lockdown. It's extremely quiet, but there are still people out on the streets. Now, they are allowed to go out and buy food. They are allowed to even get a bit of exercise. But French authorities have been saying that people are just not respecting the spirit of these rules. You still see groups of people almost socializing together. And I have to say, it is the first really nice spell of sunny weather in France after a pretty awful start to the year. So people are breaking the rules some of the time. So there is a possibility that the rules could get stricter. We've had public figures out today, the French police chief, the Paris police chief rather, saying that people should not go on trains and go away for the weekend or go away on some kind of holiday, because every time they do so, they are spreading germs and spreading the risk of infection further in France.
Catherine, thank you very much for the update. Catherine Norris-Strand reporting there from Paris. Now, French authorities have ruled out imposing a national curfew for now, but the Interior Minister Christophe Castaner said he supported initiatives from mayors to get people to respect the lockdown measures in place. Here in Paris, police have imposed a ban on the banks of the River Seine and the Invalides Plaza for this weekend. Confinement measures will also be more strictly enforced here in France. Take a listen.
What we did this morning was not to make the confinement measures stricter. We know they're difficult. We decided their implementation will be more strictly enforced. People in train stations, for example, will be reminded of the current rules and their behavior punished, because there are no exemptions for weekend trips. The battle we're fighting requires avoiding travel, so that if you're infected and you don't know it yet, you don't spread the virus all over France.
The French Interior Minister Christophe Castaner speaking there earlier. Now, the coronavirus has hit the east of France particularly hard. Hospitals there are overwhelmed by the growing number of cases. The local hospital in the city of Colmar has run out of beds in the intensive care unit. Claire Rush reports.
This coronavirus patient arrived in the emergency room at Colmar's hospital on Thursday. Without this ventilator, he wouldn't be able to breathe. Doctors want to transfer him to intensive care, but all of its beds are occupied, mainly by coronavirus patients. Facing a crisis, staff have to turn to other hospitals in the region for help.
Ce qui nous manque le plus aujourd'hui, c'est des places en réanimation. Mais ça se décrète pas en claquant des doigts. Ce qui est sûr, c'est que les vraies bonnes décisions, elles auraient dû être prises il y a plusieurs mois. Maintenant, c'est trop tard, on est dans la nasse. Maintenant, on gère la crise. Point.
When a bed is available in another hospital, the patient is transferred there by helicopter or ambulance. A nearly 70-kilometer journey from Colmar to Strasbourg is soon to be underway.
Pour être intubé, pour qu'il soit sédaté, on met des drogues qui peuvent entraîner des chutes de tension. Donc il faut toujours jouer entre la sédation du patient, ses tensions.
Beds aren't the only thing lacking. Medical supplies are as well.
On a récupéré du manugel, notamment auprès des bureaux de vote. On a un karting qui nous a proposé des tenues comme ça, manches longues, qui couvrent, qui sont faites en tissu aussi, et qui, à mon avis, feront très très bien l'affaire.
Personnel from other units in Colmar's hospital are now working in the emergency room, leading many to exhaustion. But some locals are stepping up to lift their spirits. This man's restaurant has had to close to the public because of the government's lockdown, but he's decided to put his stock to good use, feeding the hospital workers.
And the death toll from the coronavirus continues to rise over in Italy. In the past 24 hours, 627 people have died, taking the total number of deaths there to over 4,000. The country remains in a state of lockdown. This as authorities try and stem the number of new infections. For more on this story, here's our correspondent Seema Gupta reporting from Rome.
Just looking at these immense figures, they're just shocking and absolutely heartbreaking. And it feels as if it doesn't expect to slow down in any way. And the head of Italy's Civil Protection Services, though, he made it very clear, we are nowhere near the peak. And he says they are looking at the trends and they're trying to track the infection rate. Just to take note, 4,670 infections increased in the last 24 hours. He said that he believes that the peak could be perhaps next week or maybe even the week after. The health authorities here are making it very clear. Now, these infections and deaths that you're seeing are a result of infections that happen before the lockdown measures were put in place. We're only at day 10 of the lockdown, and you have to give it, they say, at least 2 weeks to see whether there's any kind of impact at all. So essentially, we'll just have to wait and see. We are not seeing any impact from the lockdown right now, and that's why we're seeing these very, very shocking numbers. Clearly also the elderly population, going back to that issue, the authorities have said that those who have succumbed to the disease are generally over the age of 70, and they also often have pre-existing health conditions that make them particularly fragile and easier to succumb to COVID-19.
Seema Gupta reporting there earlier from Rome. Now, the largest state in Germany will be entering a lockdown to prevent the spread of the coronavirus. While Germany has introduced measures to restrict public life, authorities have stopped short of imposing a full-scale lockdown like the ones we see in France, Italy and Spain. German Chancellor Angela Merkel will be meeting state premiers to discuss a potential lockdown on Sunday. Now, while Germany does have a large number of coronavirus infections, the death toll is amongst the lowest in the world. For more on this story, here's Nick Spicer reporting from Berlin.
The scientists are still wondering if the data is reliable. If you look at the countries that have the coronavirus, Germany comes in 5th place for the after China, Iran, Italy, and Spain. We have about 14,000 people infected, as you were saying, but only around 45, probably near 50 now as the numbers sadly climb, who have passed away from COVID-19. So that's about 0.2% lethality, whereas it's 4% in some of the other countries. So what's up? Well, massive testing, 160,000 tests for COVID-19 per week, which is as much as some countries have done since the beginning of the crisis. There is also an infrastructure here which is quite substantial. The critical ventilator units that allow the people whose lungs have been hurt by this COVID-19 are large in number, 25,000, and the ordered 10,000 more. And looking forward, it has transformed and requisitioned hotels and convention centers into future hospitals to deal with a potential tsunami of victims. There's a convention center here that is being transformed into a hospital which will receive 1,000 people. And another critical element, which is, I guess, just a factor of luck, I should say, the relative youth of the victims so far, the 14,000 odd people who have come down with the virus. Average age 47, so they're not in that danger zone. Many of them we know came back from vacation skiing in Italy and Austria. So those are the things that are working in Germany's favor. Now, all of the scientists are saying, as they have been throughout this crisis, the numbers change day to day. They're looking at these hypotheses in terms of policy models that can be replicated elsewhere.
Nick Spicer reporting there from Berlin. Now, the US President Donald Trump says he's not considering a nationwide lockdown. This after the two epicenters of the pandemic in the United States issued tough stay-at-home orders. Non-essential workers in New York and California have been ordered to stay at home. For more on what the new shelter-in-place order means in California, here's Alyssa Cavalry reporting from LA.
Nearly 40 million people have been ordered to stay inside their homes in an effort to help prevent the spread of the coronavirus. California Governor Gavin Newsom issued the order on Thursday night, and it goes into effect immediately. It was just 1 hour after the city of Los Angeles issued the same order for their residents. Now, we have no idea at this point when the order will be released, but basically people are being asked to stay in their homes unless it's essential that they leave. Businesses that remain open during this stay-at-home order include gas stations, pharmacies, grocery stores, banks, and laundromats. And restaurants are also open, but they are only allowed to serve takeout and delivery items. Under state law, violations are punishable by a fine of up to $1,000 or 6 months in prison, although Newsom stressed that he doesn't plan on having police actively enforcing that. The governor is also asking for the U.S. Navy's Mercy Hospital ship to be stationed at the Port of Los Angeles to help with the increase in cases. It is expected to arrive in the next 5 to 10 days. In his request, Newsom says he thinks 56% of the population of California will be infected with coronavirus within the next 8 weeks. That's over 25 million people, as California has 40 million total in the state. Currently, there are over 1,000 confirmed cases of coronavirus in California and 19 deaths.
Now, authorities in South Korea are coordinating with neighboring China and Japan over the number of people arriving in their respective countries with the coronavirus. South Korea once had the second highest rate of infections in the world, but instead of locking down the country, it relied heavily on testing.
It's one of the first countries to have recorded cases of COVID-19 after its outbreak in China. But in South Korea, authorities decided not to follow China's example and lock down entire cities. Instead, the country relied on widespread testing and voluntary social distancing to fight the virus. This is not your usual drive-through. Here, South Koreans can be tested for the coronavirus in less than 10 minutes without even leaving their cars. And now, a South Korean hospital has set up individual consultation cabins, allowing doctors to assess patients behind the safety of a plastic panel. Patients answer questions and may give saliva samples. After 7 minutes, the test is complete and the cabin is entirely disinfected.
기존에는 넓은 음압 병실에서 검체 채취를 하면서 소독과 환기에 많은 시간이 들었습니다. 보통 8에서 9명 정도 하루에 검체 채취를 하던 것에 비해서 이제는 7, 80명의 검체 채취가 가능해져서 거의 10배가량의 효율성 증가가 생겼습니다.
These screenings, along with extensive efforts to isolate infected people and trace and quarantine their contacts, are credited with bringing the country's outbreak under control. But they're not out of the woods yet. Authorities have warned of new small cluster infections emerging in the metropolitan area.
That's it from me. Thanks for watching.